All right, let's finish out this introduction. I recorded it once already and lost it, so we're going to redo it. In the course packet, Learning Plan 1 is all about professionalism. Look at the learning activities real quick. Under number 2, review ANA Scope and Standards of Practice, Standard 14, Professionalism. That standard tells all nurses exactly how to act. It's just that simple. It lays out exactly what is expected of a professional nurse. Number 4 has the standards and practice of ethics. Nurses are frequently encountering ethical dilemmas. In management, you'll be talking about some ethical dilemmas. We need to understand what's our expectation, or what is expected of us, I should say, so that we can properly respond and act in a professional manner. So we expect you to review those standards and have an understanding. Now, those standards drive our evaluation of you. If you look at the evaluation grid, the very first one is implement one's role as a nurse in ways that reflect integrity, responsibility, ethical practices, and an evolving professional identity as a nurse committed to evidence-based practice, caring, advocacy, and quality care. That's the first grade you get. It's probably the most important. It's the basis of all of nursing. Professionalism, ethical practice, evidence-based, caring, advocacy, and quality care. So, what does it mean? Comply. We have them listed right here. Comply with agency and school policies, state laws, and industry standards. Treat all individuals with dignity and respect. Protect patients' rights to privacy, autonomy, and confidentiality. And it goes on in specific detail. Every one of our performance criteria has detailed statements of exactly what we want to see and exactly what will give you 5s or 2s. Let's look at that. Treat all individuals with dignity and respect. Remember I told you about the sims where the 2 students were standing over the simulator and talking about the patient in ways that they would never have talked in the hospital. They were not treating that individual with respect and dignity. And they lost points for that in that simulation. They wouldn't do that in the clinical site, right? You'd never stand over a patient and talk about his behaviors or history or whatever in an inappropriate manner. So that is how we evaluate you. We're giving you the answers. We are giving you the answers to getting good grades because this is what we want to see. Demonstrate appropriate professional behaviors and work ethics. In other words, attend clinical as scheduled and on time, exhibit honesty, open and positive attitude, accepts feedbacks, maintains boundaries, accurately reflects on practice, and maintains a professional dress code. What else is there to say? So that also says, though, that's what we expect. So when you show up on time and you have a good attitude and you have a clean uniform, that's not a 5. That's not exceeding expectations. That is the expectation. So this is your weekly grid. I'm not going to read every standard. I'm not going to read every performance criteria. I expect that you can do that, and you need to do that. You need to know what we expect. Just because I haven't read it doesn't mean it doesn't apply. Let's look at one real quickly. Demonstrates appropriate written, verbal, and nonverbal communication in a variety of clinical contexts. Number 7 is use appropriate terminology, spelling, and grammar in written communications. That's important. That's there. Now, if I hadn't read that and you turned in a paper to me with a lot of spelling errors, I'm going to grade you on those spelling errors. If you use improper terminology in your documentation, I'm going to point that out, and you're going to have to correct it or amend it. And that'll reflect on you. You need to know what we expect so that you know what to produce. Look at another one real quickly. Implementation. Contribute to a positive patient and family experience by determine and support patient and family preferences. Demonstrate caring behaviors toward patients and families. Consider patients, families, and community when implementing plan of care, and respond to lights in a timely manner. Well, if I'm standing outside a room listening to my student talk to the patient, saying, "How are you doing, Mr. So-and-so, and what can I do for you, and how is your pain, and blah, 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 blah," and they never address Mr. So-and-so's wife, who's in the chair next to them, that's a 2. They're ignoring the patient's family. And I don't consider there to be a patient. I call that the patient unit. And the patient unit is the person in the bed and everybody that is with that person. Spouse, parents, children, siblings, friends. If you don't interact with everyone, at least briefly, you're not caring for everyone. An important question would be always to the family, do you have any questions for me? If you don't ask that, if you don't invite a question, they may be afraid to ask a question that they need to know. So ask that question. If you ask that question, if you interact with the family, if you care for the family as you do the patient, that's good. That's what I watch for, what I listen for. Also, specifically, that's what I go into your patients' rooms when you're not there and ask them about. Yes, I do that. I'm telling you that right now. I go behind your back to see what you're doing because I'm not there 24/7. Can't be. I've got 6 to 8 other students up there. So you need to realize that everybody's always watching you. And everyone talks to me. They just do. So this is the weekly grid, the weekly evaluation. We want you to review yourself on that 5-4-2-0 scale. Give yourself a 5 if you feel that you've exceeded these expectations. And put a little star or a plus sign, I meant to say plus, in these specific performance criteria that you think are where you earned that 5. And then reflect on that completely further on in this grid. If you think you've earned a 2, give yourself a 2 and then put a minus in those areas where you think you fell short. And again, reflect completely further on in this grid. I want you to talk about why you did 5s or 2s. And you may have done some good things, but they don't rise to a 5. But you just think they're good. Go ahead and put a plus there. You can still give yourself a 4 and then talk about that, why you give that plus. The more clearly you communicate your thoughts, the easier it is for all of us to give you the grade that you think you earn. Now, if you give yourself a 5 and it is clearly just the expectation, we will change it to a 4 and explain why. If you give yourself a 4 and it's actually a 2, we'll tell you why. In all likelihood, you'll know why you're getting a 2. We tend to be pretty open about our concerns when they happen. In other words, if we point out an error, you might want to consider where that 2 is appropriate. Towards the end of the grid is the comment area. And there's an area for weekly comments. Here's where you will talk about the 5s and the 2s. And I want you to talk about the 4s also, although you don't need to go in such great detail for everything that's a 4. But do tell me what went on. If you think you got 4s top to bottom, at least tell me what you did during the day. what you did that, what you experienced. Students, when they do this, they begin to realize how much they really did and what kind of interesting and new things that they've experienced. And I want students to focus on their successes. When you get those 5s, here's where you're going to write about the 5s. 5. And I want you to follow the what, so what, now what approach. You don't have to write what, so what, now what if you don't want to, but I want you to answer it like that. So, what happened? So what would be, why is it significant? Either significantly good or significantly not good. And now what? If it was a good thing, what are you going to do to enhance it, to spread it, to maximize your strengths? If it was a mistake, what are you going to do to prevent that from happening again? And how can you teach other people so that they don't make that mistake? What, so what, now what? When you do that in this grid, this explains to me that you understand what's good, what's not good. And that's an important understanding. If we go to Learning Plan 2, that's the care of the laboring patient, and I will be totally honest here right now, I have no idea what goes on in this simulation. None. You'll be working with Tammy Spurl on this. And my understanding, though, is this simulation is quite fun, that it's exciting, and I've never had a student unhappy after this simulation. And this simulation is important to have this done before you go to your women's health experience in the clinical setting. Again, there are some learning activities and outcomes. There are quite a few learning activities that you have to do prior to this experience. There are some DVDs that you need to watch from the library. Review the PowerPoint presentation from health promotion. There's some sections of your textbooks that you need to read. You must read these so that you are prepared. There are medications that you need to be ready to work with. So have some med sheets for Pitocin, prostaglandin, Nubain, Pepcid, Bicitra, and Robenal. What are they? You need to do the med sheets so you know what they are, okay? It's important. Do the self-study packet on basic fetal monitoring. Develop a plan of care or a care map so that you're ready to go. Review all of this information and do the work as required. Excuse me. As with everything students do, if you rush it, if you don't put your full effort into it, it's always obvious. Again, we're telling you exactly what you need to do to get a good grade. When you don't give yourself enough time, you won't get a good grade. Because here's the rubric on this OB simulation. And let's just talk about this, just one section, okay? I'm not going to read all of it. But the OB concept map is completed using a holistic approach when developing nursing diagnoses with appropriate assessments and interventions. Appropriate interventions and assessments. Identification of realistic goals and a recognition of the connection between diagnoses. Important information from the prenatal and admission assessment is identified, not just listed. Identify what's important. When you do all that, you'll get 20 points. If you leave off information from that prenatal assessment, you're going to lose 5 points. If you miss entire components on this care map, you'll lose 10 points. It's very specific. This rubric and any rubric for any of these assignments you need to take out of this packet and have right beside you as you're working on it. Follow along in that first column. If you want the full grade, follow that first column and do everything it asks for. Because if you leave a part out, you're not going to get those points. It is real simple for us instructors to grade this. We look at what's supposed to be there. Is it there? Great. Is it not there? All right, now we know how to grade it. It makes my job very simple, but it should make your job equally simple. You can choose your grade. How much work do you want to put in? Do you want to leave chunks out? I leave chunks of a grade off. So these rubrics are detailed for you to make your job easier, to make you more successful. But you need to put the time in to do it. Here's what you need to do for the care map, the self-study packet. A lot of work here, just a lot of work. It's going to take time. Do not wait till the night before to do all this. Every semester we see students who wait till the night before to do their work, and it shows. Excuse me. Sorry. And it shows. Don't do that to yourself, because there's only one person that suffers. You. We do the same work for thorough job or minimalist job. It's up to you. All of your successes are up to you. Learning Plan 3 is on the care of the complex patient. This is the heart and soul of this clinical. This is where things get real. Excuse me. Getting over a cold and still got some But I don't have a fever, so I don't have to wear a mask, and I can be at clinical. So in this learning plan, there's a lot of things you need to do. We want you to review standards 1 through 6 of the ANA Standards of Practice. You will need to attend clinical and participate in simulations. Don't just stand there letting other people do the work. You will be graded accordingly. You'll be caring for up to 3 patients. Not 2 anymore. 3. That's only 1 more than you were, but that's actually 50% more than you were working before. You can do it. You can. I know you can, because you've made it this far. And you'll be getting complex patients. You won't get 3 people who have simple knee replacements. No. You might, one of those might be a knee replacement, but the other one might be a recovering stroke, and you might have a person who's alcohol withdrawals or GI bleed. Yeah. Who knows? It could be everything. I look for complex patients to challenge you, not to break you, but so that you can demonstrate your strengths. If you have simple patients, you can't demonstrate how much you know. Only when you push yourself, only when you challenge yourself to go beyond, can you truly demonstrate that you know what you know. So you may have days when it feels like you got the worst assignment. That's not true, but it's going to be busy. I won't kid you on that. But I'm here for you, as is all the other instructors. And so are the nurses on the floor, as are your peers. They work together so that you all succeed. So that is what needs to be done for clinical. And talking a little bit more about the clinical situation, you're going to be dealing with complex people, like I just said. But you're also going to have the chance to shine. What do I mean by that? You'll be working with staff members closer than you were in 3rd semester. They'll have a chance to observe you. They'll have a chance to interact with you and collaborate with you. And they'll have a chance to watch you. When you apply for a position getting close to graduation, if you apply at the position where you're at the hospital where you had clinicals and you were good and you shined and you participated and you collaborated, they're going to remember you. They will. If you didn't collaborate, if you didn't shine, they're going to remember that too. Consider this to be a very long, in-depth job interview. Every semester I have students that complete clinicals with me at Holy Family and then get hired at Holy Family specifically because they had clinicals there. And that's true at all the hospitals. Students who had clinicals in advanced clinical get hired at those places. Other things on the clinical site is you'll be doing skills that you maybe haven't done for a while. And as I mentioned earlier, go to the skills lab, practice things. I look for PICC line dressings and IV starts and Foley placements, drain tubes to be removed. Make sure you know how to do those. Now, you may not be familiar with the packet of supplies at each individual hospital, but the techniques are unchanged. Sterile field technique is sterile field technique no matter what color your gloves are. I say that because one semester I had a student who was not familiar with sterile gloves that were purple. It sort of panicked her because she just wasn't expecting it. Part of this clinical is also dealing with change. You need to adapt to changing situations. Your patient may get sicker. Your patient may be discharged. Your patient may die. Doesn't happen often, but it does happen. So you need to adapt to changing situations. You need to be able to apply what you know to the current situation. And when you can do that, you get good grades and you succeed and you shine. We have information on the sims. A lot of information on the simulations. These are detailed and complex patients, but I've had students experience real-life situations mere weeks after doing these simulations. So they're useful, and these are all seen, at least at some point, on a med-surg floor. So understand these medications, understand these treatments, understand how to apply the orders, understand how to work together. Have a plan before you go into this. Talk to each other. I said that earlier, but I'm emphasizing it. Become a team before you even show up so that you're ready to go. Make sure you have all of your prep done for these simulations. There's a lot of questions that we want you to answer and write. Don't just look at them. Write them out. Know them. Because if you know the answers to those questions, you'll handle the simulation fine. If you don't, it's always obvious. It really is. I know sometimes students think that they can just kind of bluff their way through. You can't. You really can't. I'm not trying to say that this is all bad, because most students are great, most students are prepared, most students succeed. But once in a while, there's problems. And I want to help you avoid those. I want you to succeed. I want you to avoid those pitfalls that some people get tripped up on. In Learning Plan 4, we're going to do the evidence-based practice in service. This is the most fun. That's an exaggeration. It can be a lot of fun, though. It depends on how you want to present your information and what topic you chose. So how do you find a topic? Go to guidelines.gov. That's an excellent source of evidence-based research. Go to the ANA, Standards of Professional Nursing Practice. Standard 8 is education, 9 is evidence-based practice and research, and 10 is quality of practice. Now, evidence-based practice and research, I think it's safe to say that many nurses are uncomfortable researching evidence. But it's so important. It's so important because Joint Commission and accrediting agencies, they look for that. That is a major focus of what they're looking at. If you don't know how to do evidence-based research, you are already behind the level of expectation. So, research. Choose a topic and dig into it. I'll use a specific topic, scrubbing the hub, and then comparing it to what happens in real life. That's part of the in-service, is to compare what you researched to what's happening on your clinical site. I had a group of students that not only had hands-on manipulatives for bodily kinesthetic learners of practicing to scrub the hub, but they came up with a little song to sing while scrubbing the hub. It was awesome. It was really exciting to see such innovation, such creativity, and truly the students had fun with that. It does not have to be a simple PowerPoint. You can have fun. You can do what you need to do to get the information out to all of us. Let's look a little bit deeper at what we expect of this assignment. Oh, look, we have a rubric. We also have an exhaustive explanation of what needs to be done, and on here we have one of the key concepts is writing the PICO or PICO question. What's a PICO question? You better look it up. You'll need to know how to make one. We'll talk about it in management. So it's in your management book. The ability to write the right question is probably one of nursing's biggest challenges. Understanding the question. You can't find the answer until you know the question. And so the ability to write a PICO question will almost guarantee you get the correct answer. Okay? So let's look at the rubric. And again, when you do your work, you better have this rubric right next to you, following along, doing exactly what it asks for, because then you'll get the best grade. And I've said that over and over, but it applies every time. Know what I want. Know what Joy, what Vani, what Jill, know what we want. Carrie, know what we want. Give us what we want, and you get the grade that you want. Does that make sense? It should. It's pretty basic. We make our expectations very clear on paper, and we give it to you. Now it's up to you to use it. So for the first section, the learning objective points, you have a PICO question for evidence-based project, and you submit it to the instructor at least 1 week prior to presentation. You give the instructor the learning objectives at least 1 week prior. You write those objectives in a behavioral learner-based format, which says the learner will, much like when you write your goal statements for your nursing diagnosis, in that the patient will. You identify specific cognitive, affective, and psychomotor objectives. Excuse me. And specific learning evaluation methods are identified. There you go. That's how you get 10 points. Boom. If you do those 5 points. If you turn it in the day before the in-service, you just drop down to 8 points. That one act lost you 2 points. If you don't identify a PICO question at all, down to maybe 3, maybe 0. So we're telling you exactly what you have to do to get the best grade possible. Again, what you do is up to you. We're telling you what we want. We believe in making our expectations clear. Because when I clearly explain what I want, I have a better chance of getting what I expect. Learning plan 5 goes to the heart and soul of professionalism again. Leadership, collaboration, and communication. If a student can't lead, if a student can't delegate, if they can't communicate in writing, verbally, they're going to have a very difficult time being an RN. It's just that simple. You need to review the standards of nursing practice. Standard 11 is communication, 12 is leadership, and 13 is collaboration. Those 3 standards, each one of those have their own separate standard. That's how important they are. Communication. Clear, written communication using good spelling, proper terminology, appropriate timing. For example, let me give you a specific communication problem. I've had a student, not often, one time recently, where they got their vital signs, they did their assessments, but they didn't document them for a couple of hours. That's a problem. First off, at Holy Family, there's a computer in every room. And the standard policy and procedure of the hospital is you document in the room in front of the patient. So by waiting, you've already broken that policy. But it's also not timely. I always ask the student, what are you going to do if you haven't documented those vital signs and the physician shows up to review the records and doesn't see recent vital signs? How are you going to explain yourself to that doctor? And what's your valid reason? I'm not going to say excuse because there's no excuse. What's your valid reason for not putting it in? So, communication, leadership, collaboration, working together, delegating as appropriate. And you may be in a position to delegate. In fact, you probably will. You'll be in a position where you can ask CNAs to do some things for you. When you were taking care of 1 and 2 people, you did a lot of the hands-on skills for those patients. But when you have 3, you will be not able to do everything as you did before. You'll be delegating out some skills, and that's appropriate. Now, again, for this clinical, it is a PM shift. So it's a very different atmosphere, different mindset than what you have been used to. Morning med pass, huge. PM med pass, much smaller. But you have more people. So it balances out. PM shift is different in that there usually are fewer doctors around. There's less managers around. It is a different type of job. And we put you on PM shift. One of the reasons is to experience it. Because a lot of times new hires will not get hired to day shift, but to PM or night shift. This gives you an idea of what it's like. Personally, I love PM shift. PMs and nights, love them. Day shift, not so much. Learning plan 6, the last part of it, excuse me, is for students that are at the Aurora Hospitals or St. Nick's. Those 3 hospitals use Epic for their computer charting, their electronic health records. Epic is, from my understanding, an awesome, robust, nurse-focused, easy-to-use system. The reason why I say my understanding is I've never been trained on it, I've never used it. Holy Family uses a different system called Meditech. Also, easy to use, nurse-focused, but it's very different. And that's okay. If you go to Holy Family and you've never been there before, you just use Epic, it's probably good to get experience on a different system because you don't know where you're going to end up working. You don't know what system could be in place at your new employer. Certainly could be Epic. It is gaining traction statewide and across the country, but it is not the only system. So the ability to flex and learn new ways of doing things is a skill that will not hurt you to be able to do. So don't be afraid to go places that you've never been before. That takes us to the end of the course packet and the end of my talking, which is probably good for my throat. This clinical will push you. It's going to be difficult, but you will grow into it. It will expose you to more significant patient conditions, but that's what it's supposed to do. You need to be ready to graduate because you're graduating in just a few months. And you need to be ready to tackle these type of skills, these type of patients in just a couple months. Look for opportunities. Look for things to do to make yourself stand out. Stand out among the other students, stand out among the nurses. Let me give you a specific example of what I just experienced last semester. I had a student that needed to give, had a patient and needed to give them soap suds enema, and got the order and preparing to do it. And she's like, no problem. No, I've done it before. The nurse that she was working with was a relatively young nurse, and this nurse had never given nor seen given a soap suds enema. Ever. Not in school, not on the job. My student got to teach the staff nurse how to do this. So, my point there is that nurse should have found a way to experience that as a student. Don't you think? So I will look for things for you to do, but I want you to look too. I want you to use this 8-week period. I want to use this rotation as your final sharpening of the knife, final honing. Get good. Get great. Demonstrate to everyone around you exactly what you can do. It will go by so fast. You will be just astounded at the pace that this goes by. Stay organized. Know what needs to be done at every hour of your shift and at every hour of the day when you're not on the shift. Have a plan for every day, not just clinicals, but every day of the week. Know when you're going to study. Know when you're going to work on your care plan. Know when you're going to work on your grids and your journals. Know when you're going to study for CHA. Have a backup plan for everything. And don't wait to the last minute. When you rush a job, when you rush an assignment for any of these final classes, these are all high-level complex classes. When you rush those assignments, the quality always suffers and the grade suffers. And I don't want that to happen to you because it's so avoidable. It's under your control. This is the point where I normally say, any questions? But obviously you can't ask me any questions. But you can send emails to me or any of your instructors. Ask us questions. If I missed something in this orientation, your instructor may cover it face-to-face when you meet with him or her. They may not. In which case, ask. If you don't ask a question, we assume you don't have one. Now, to be honest, I know people have questions, just don't know what they are. And I can't answer a question that I haven't been asked. So, that's all I have to say. This is actually going to be a fun clinical because you are going to surprise yourself at how much you can do and how quickly you grow. And that is always exciting and makes people enjoy. Maybe fun's the wrong word, but they feel satisfied when they accomplish a challenging skill. So that's what's going to happen to you, and I can't wait to see you face to face, either in clinical, in transitions, in management, at an LCSNA meeting, or in the hall. Don't be afraid to introduce yourself. I'm Trevor. and we're going to have a great semester. Talk to y'all later, and this time I'm going to save this.